Pneumonia is a respiratory infection that inflames the air sacs in one or both lungs, which can fill with fluid or pus, causing a range of symptoms. Individuals with pneumonia may experience a cough that produces phlegm, fever, chills, and difficulty breathing, which vary in intensity depending on the severity of the infection. It can also present with chest pain that worsens with breathing or coughing and general fatigue, making daily activities challenging. Treatment typically involves antibiotics for bacterial pneumonia, antiviral medication if it's viral, and over-the-counter remedies to alleviate symptoms, along with plenty of rest and fluids. People at higher risk for developing pneumonia include the very young, the elderly, those with weakened immune systems, or with underlying lung conditions. For a deeper understanding, here's detailed aspects of the disease. Symptoms and progression of pneumonia. Pneumonia, an infection that inflames the air sacs in one or both lungs, manifests with a spectrum of symptoms ranging from mild to severe. Coughing often produces phlegm or pus, accompanied by fever, chills, and difficulty breathing. Chest pain that sharpens during coughing or breathing is common. As pneumonia progresses, it may lead to rapid breathing and a bluish tint to lips and nails due to oxygen deprivation. In severe cases, confusion or delirium, especially in older adults, signals the urgency of medical attention. Without treatment, the infection can worsen, potentially leading to respiratory failure or sepsis, a life-threatening response to infection. Diagnosis of pneumonia. Pneumonia diagnosis is critical as it often presents with symptoms that mimic those of other respiratory ailments, making it challenging to diagnose without proper medical assessment. Physicians leverage a combination of patient history, physical examination, and diagnostic tools. They listen for abnormal lung sounds with a stethoscope, indicative of consolidation. Chest X-rays are pivotal, revealing areas of opacity representing fluid or infection in the lung tissue. Alongside, blood tests assess white blood cell count, which can be elevated in response to infection. Sputum cultures help identify the causative organism, directing appropriate antibiotic therapy. With the advent of rapid point-of-care tests, diagnosis is becoming more efficient, reducing the onset time of targeted treatments and improving patient outcomes. Cause and risk factor of pneumonia. Pneumonia, a significant respiratory infection, is primarily caused by an infiltration of pathogens such as bacteria, viruses, or fungi into the lungs alveoli. Streptococcus pneumoniae is the most common bacterial culprit, while viruses like influenza and respiratory syncytial virus are frequent viral agents. Inhaling these microorganisms can trigger an immune response resulting in inflammation and fluid accumulation, impeding proper gas exchange. Risk factors amplifying the likelihood of developing pneumonia include a weakened immune system, chronic diseases like COPD or diabetes, recent viral respiratory infections, smoking, and hospitalization, especially when ventilators are used. Seasonal and age-related predispositions are also observed, with the very young and elderly being more vulnerable. Treatment and management of pneumonia. Treatment and management of pneumonia prioritize eradicating the infection and supporting lung function. Antibiotics serve as the frontline therapy for bacterial pneumonia, while viral pneumonia may benefit from antiviral medications, though it often resolves on its own. Supplemental oxygen or mechanical ventilation can be life-saving for those with compromised breathing. Hydration and rest are key supportive measures. In severe cases, hospitalization provides access to intravenous medications and close monitoring. Prevention, through vaccination and good hygiene practices, plays a critical role in reducing the incidence of pneumonia, especially among vulnerable populations such as the elderly and immunocompromised individuals.